My name is Wayne Shelton. I'm a professor at the Alden March Bioethics Institute. I am co-author on a paper that's going to be published soon in the Mayo Clinic Proceedings. It's entitled A Comparison of the General Medical Consults and Clinical Ethics Consults. What can we learn from each other? The first author on this paper is Dr. Cynthia Geppert. Dr. Geppert is the Chief of Consultation, Psychiatry, and Ethics at the New Mexico VA Hospital. She's also Director of Ethics and Associate Professor at the University of New Mexico School of Medicine. The motivation for this paper that Dr. Geppert and I wrote came from the fact that we couldn't find, in fact, anything in the literature that really compared ethics consultation and medical consultations. And we thought, since there was so little known about it, it would be a good service to provide, especially for physicians who may not know a lot about ethics consultation. What we did was look at both types of consultation and systematically reviewed them in terms of their goals, the roles of consultants, the methods and approaches they used, and then tried to discern some of the lessons that we could learn from this comparison, and especially what medical consultants and physicians can learn from ethics consultation. In the last 20 years, in particular in the last 10 years or so, ethics consultation has become very commonplace in today's hospitals. They are more and more considered an integral part of quality health care for patients because they deal with the difficult ethical questions that come up in the course of patient care. So in both types of consultation, medical and ethics, consultants look at the facts of the case. But in ethics consultation, we point out in the paper that it's the larger fact pattern of the case that ethics consultation focuses on. This is to get a sense more of who the patient as a person is. And in particular, we look at things like quality of life considerations and the larger contextual features of a case, such as the family system in which the patient is a part, the patient's religious and cultural background and values. We look at relevant legal considerations that might have a bearing on the case, and those kinds of things. So we get a larger sense of who the patient is, and often that helps ethics consultants clarify the underlying value-laden questions, which in turn helps to clarify rights and responsibilities of both patients and care providers. Whereas on the other hand, medical consultants tend to look at more of the medical facts. They're looking to try to find the correct diagnosis and come up with the correct treatment options. Both then valuable services, but they focus on different areas. Expertise in each type of consultation is different. In medical consultation, the process is fairly well defined, and I won't bother getting into that. It's interesting that in ethics consultation, expertise is still under considerable discussion within the field. The American Society for Bioethics and Humanities has come up with a set of core competencies expected of all ethics consultants. There's active discussions underway about how we might certify qualified ethics consultants and even possibly accredit programs that train ethics consultants. But to date, no final decision has been made on that. We go on to look at the various approaches to both types of consultations, the various steps that are taken in consultations to compare and contrast the similarities and differences. Just going over some general conclusions here, we basically show that both types of consultations are really important if we are going to provide comprehensive total care for the patient and address all the types of concerns, issues, and questions that come up in the course of patient care. So medical consultation and ethics consultation, we claim, are very complementary. They're not in any kind of opposition to one another. Both Obviously, the medical consultant is part of the care team, but we think it's important also that the ethics consultant be considered a member of the care team and be integrated into the care team with full regard and respect. Each consultant brings different types of expertise to bear. In the case of medical consultants, they obviously bring to bear scientific medical expertise in formulating a diagnosis and a treatment plan that they're going to recommend. The ethics consultant has a knowledge of ethical principles, ethical and professional standards that they bring to bear on particular cases, and they have other types of communication core skills that they use in building a consensus in a particular case. In both types of consultations, it's really important to note that they do not make binding unilateral decisions. They make non-binding recommendations, in fact. I know some people over the years have thought of ethics consultants as ethics experts and giving people the right ethical answer. And in fact, we are showing the paper that's not true. Ethics is, in the way we do clinical ethics in a hospital setting, is very much a procedural process. So ethics consultants help facilitate a procedure by involving a lot of people, and we make the point very clearly that ethics consultants are not moral experts. There are some important lessons to be learned from what we go over in our paper. One is that it's important to prevent the problems that lead us to ethics consultation. It's by addressing ethical concerns and potential conflicts before they develop to a real crisis level. And also, ethics consultants must be viewed as full team members with something important to offer. And I think more and more people are recognizing that if we don't do that, then something is missing in the quality of patient care. And finally, clinical ethics and clinical ethics consultation is an important part of physician education, and as evidenced by the fact that many more physicians are interested in learning about this field. If we continue to go in that direction, physicians will be able to work with ethics consultants in a way that best promotes patient interest and quality of care. In conclusion, medical consultation, ethics consultation offer complementary perspectives. Both complement the primary physician-patient relationship, and there are very important lessons to be learned from this comparison. Hope that was helpful, and thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.